Can you stop Rybelsus suddenly? What actually happens? And why medical guidance really matters. Before we get into it, just a quick note. This video is for general information only and does not replace advice from your own healthcare professional. Please don't stop, start, or change any medication without speaking to your doctor first. So, can you stop Rybelsus suddenly? It's a question a lot of people have, and the answer is a little more nuanced than a simple yes or no. Rybelsus contains semaglutide, and it belongs to a class of medicines called GLP-1 receptor agonists. It's prescribed to help manage blood glucose levels in people with type 2 diabetes. And here's the reassuring part. Rybelsus does not cause physical dependence. Stopping it won't trigger a withdrawal syndrome the way some other medications might. So in that sense, yes, you can stop it suddenly. But, and this is important, stopping without medical guidance is still not recommended. Here's why. Rybelsus works by helping your body release insulin in response to meals, suppressing a hormone called glucagon, slowing gastric emptying, and reducing appetite. When you stop taking it, all of those effects gradually fade. Because the medication has a half-life of around 1 week, those effects can persist for several weeks after your last dose, but they will diminish over time. Once the medication clears your system, your blood glucose levels are likely to rise. Your HbA1c, the longer-term marker of blood sugar control, may increase, potentially returning towards where it was before treatment. That matters because poorly controlled blood glucose over time is linked to serious complications, including cardiovascular disease, nerve damage, kidney problems, and eye conditions. Appetite suppression also fades, so any weight changes you experienced whilst taking Rybelsus may not be maintained. There are also specific situations where stopping is medically necessary. One important example is pregnancy planning. Rybelsus should be discontinued at least 2 months before a planned pregnancy, and it's not recommended during pregnancy or breastfeeding. If starting a family is something you're considering, speak to your doctor well in advance. So what should you do if you're thinking about stopping? The most important step is to speak to your GP or diabetes specialist before making any changes. Even if you're stopping because of side effects, your healthcare team can review your diabetes control, assess your individual circumstances, and make sure alternative management strategies are in place. That might mean adjusting other medications, increasing how often you monitor your blood glucose, or exploring different treatment options altogether. Never stop prescribed diabetes medication on your own without professional advice. And if after stopping Rybelsus you notice symptoms of poorly controlled blood glucose, such as excessive thirst, frequent urination, unusual fatigue, or blurred vision, contact your healthcare professional promptly. For urgent concerns, call NHS 111. In an emergency, call 999. So, to recap, Rybelsus does not cause withdrawal syndrome, but stopping suddenly without medical supervision can lead to rising blood glucose and a return of diabetes symptoms. The medication's effects can last several weeks after the final dose. And if you're planning a pregnancy, talk to your doctor about stopping at least 2 months beforehand. If this video was helpful, leave a comment below with any questions. Give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.